Today, we're going to discuss a very interesting and a very significant topic, which is related to animal poisoning. So, you would come across these different incidents of insect bite or animal bites, and you must be well versed with this condition. What kind of animal you're dealing with is very important over here. So, you may even come across the bee stings, the wasp stings, as well as the fire ants are very notorious, and sometimes they can inject a very appreciable amount of venom into the patient and that is going to manifest different kinds of signs and symptoms in the individual. Now, again, it's very important that you know the chemical composition of the venom over here. It is again very important to identify the sting, what kind of a sting you're dealing with, what kind of the animal you're dealing with, and then to know the difference between the poisonous as well as the non-poisonous insect bites that you're dealing with. How can you clinically differentiate between a poisonous insect bite and, on the other hand, a non-poisonous insect bite that you're dealing with? Usually, the poisonous one would have more horrendous kind of an outcome. For instance, there would be signs of inflammation, redness, swelling, necrotizing fasciitis locally would be present over there, as well as it is going to accompany agonizing pain. Sometimes systemic symptoms are found in an individual. For instance, we have venoms classically classified as being neurotoxic. They can be vascular toxic, acting primarily on the vessels and even acting or resulting in the massive hemorrhages in an individual. On the other hand, we have the myotoxic venoms, which are primarily acting upon significantly on the muscles of the individual. So depending upon the kind of the venom that we're dealing with, we must be well versed what are the symptomatic conditions that can arise in this particular patient. Because these are the venoms or these are the enzymatic actions that can be taking place underlying this kind of the venomous activity that we're dealing with. So again, it's very important that you know what is the fatality of the venom that we're dealing with. Whenever we are studying the toxicology, which is basically the subject of poisons, the general measures that we usually get to know are the fatal doses, that is the dose or that is administered in a patient which can cause the death of the individual. Again, the fatal period is very important over here. How much time do we have to act significantly and help the patient revive? This is very important. So the fatal dose along with the fatal period should be well known to you, and you should be well versed with what are the emergency treatments and again what are the do's and the don'ts in a particular case that we're dealing with. In general, when we talk about the venomous cases, the fatal cases, we must keep in mind that the general measures that should be taken are sometimes it is applicable that we should wash and rinse the area, but it is really important that you make the patient reassure that he or she must not panic in that condition. Because that is going to make the venom circulate more fastly in the human body. So not to panic in any of these situations, and then again to lower down the site of the insect bite lowered to the level of the heart. So it's again very important to keep that site lower down to the heart and immobilize the affected limb. This is again one of the very important factor over here. We've already went through the details of a very important animal bite, that is the snake bite, and we are already well versed with this a very important condition. How do you deal with the snake bite cases, and what are the different kinds of manifestations that can take place in a patient who presents to you with the snake bite? On the other hand, one of the animals that top the lists over here are the scorpions. So, having known the different facts regarding the scorpions, we must know that there are almost 25 species of scorpions that are poisonous, that can inject or that can transmit the venom into the individual when they bite or when they sting an individual. Usually, we're dealing with the accidental case of the scorpion bites. So whenever we go into the medico-legal aspects of this scorpion bites, neither it is suicidal or nor it is homicidal. The usual cases are accidental, purely accidental in their nature. So once having done that, we know that usually it is an emergency situation, and almost one should reassure the individual that only 25 species of all these species out there are poisonous in their nature. The most notorious one is the red scorpion, that is quite famous for causing fatalities in individuals. Then again, it's almost an 8 years of lifespan for these animals, and they can even live for up to a year without any food and water. So they're quite tough of the animals, and they can survive in any of these hard situations or environmental conditions, dry environmental conditions out there. So they usually survive and they're able to sting the individuals. And whenever we have these patients at our hand and they enter your emergency departments, you must know how to treat these patients effectively. Once you have these patients at your hand, at your hospitals, if they're having a difficulty in breathing, that is a situation of tachypnea, that you're encountering in these individuals. And on the other hand, we have the patients who have tachycardia. So these are the two distinct situations that can occur in a patient who is surviving a scorpion bite and he comes to you in an emergency department. Now, whenever these patients are going in a situation of tachycardia, usually either it is a systolic failure that they are encountering, or either it is a diastolic failure that they are encountering. So diagnosing this case is again very important, and treating them in the proper manner is again very important over here. The general drugs that we usually administer for these patients are the prazosin and the diuretics that are quite importantly used for these patients. The mechanism of action of the prazosin is basically it is inhibiting the sympathomimetic activity, and that is basically causing the heart to slow down, even the blood pressures to get to a normal state. So that is basically suggesting the fact that we are giving off this symptomatic kind of treatment to these patients. Usually these patients in which a venom is injected through a scorpion, the venom itself isn't fatal enough to cause the death of the individual. What is causing the death of the individual is some patients or some individuals have an anaphylactic reaction that can develop to the venom. So you would come across a lot of patients that go into an anaphylactic reaction whenever a venom is injected into them. So this is again very important that you take the history in detail from the patient, whether there has been a history of a sting in the recent past and how the patient reacted to it, whether the patient experienced any dyspnea, altered levels of consciousness, difficulty in breathing, tachycardia. All of these are basically features of the hypersensitivity reactions that can develop in these individuals. So having known or having documented the history in detail is again going to make it easier for you that how you're going to manage this individual case in particular. The treatment would again stick to the use of the prazosin, the diazepam, the fluid imbalances are corrected in the individuals, and if so, you're also going to monitor the oxygen levels in the blood. That is, the partial levels of oxygen saturation are basically monitored for these individuals in particular. So this is how basically you move on and try to recover these patients. So what are the signs of recovery after you have administered this kind of the treatment to the individual? What would be the signs? They would have warm extremities. The patient is going to get into a normal state. The tachypnea and the tachycardia is going to attain the normal states in this particular individual. So these are the particular features that you're going to look for, and that they are going to highlight the fact that the patient is reviving and the patient is responding to the particular symptomatic treatment that you're giving to this particular individual. Moving on, we must consider the kind of venom that is injected by the scorpion, the enzymatic actions that are taking place and that are basically leading to the cascade of events over here, and the final clinical picture in a scorpion bite in a patient. So the kind of venom that we're dealing with in scorpion bites is the toxalbumin. Now, this toxalbumin, how does it act and why are we using prazosin is basically the answer for the mechanism of action of toxalbumin. Prazosin basically acts by inhibiting the activity of toxalbumin, which suppresses the sympathomimetic activity that is produced by it by inhibiting the potassium channels. So this is the mechanism of action of toxalbumin, and how does prazosin as a drug act to symptomatically make the patient revive or make the patient in a better condition. That is why we're using prazosin for these individuals. Prazosin is basically a postsynaptic competitive alpha adrenoreceptor antagonist. So this is the kind of receptor activity that it has, and it basically results in the control of blood pressure as well as tachycardia, which was being produced due to the injection of the toxalbumin by the scorpion, is inhibited by the administration of this drug prazosin. So this is really helpful that you know the mechanism of action of the drug as well, and you know the mechanism of action of the venom on the other hand. Again, prazosin has the mechanism of action as it counters the vasoconstriction being produced again by the toxalbumin, and this is how it is going to counter the blood pressures in the patients as well. Now, whenever we administer these prazosin, the prognosis is very good in the individuals, but there are some risk factors that make the patient more prone to to go towards the fatality. It can be the either extremes of ages. Children less than 5 years and adults more than 60 years are basically more prone to face these fatalities due to the scorpion bites. On the other hand, if there are some premorbid conditions, for instance, the patient is suffering from hypertension, diabetes, any debilitating condition that is making the immune system of the individual more prone, is again going to be a dangerous situation for the individual. Again, if the number of bites is again very important over here, the number of stings is very important, the central location. For instance, if the scorpion bites on the neck, that is the central location. The venom is going to enter the carotids, and that is going to be a very fatal situation for the patient. So these are some of the points that you have to focus on. Either you're examining in a live patient and you're just looking to look for the prognostic factors, or on the other hand, you're examining a dead body, you're doing a post-mortem and you just want to feature down the cause of death. Then you have to look for the features, whether the scorpion bite is responsible for the death of the individual or not. So these features can basically highlight the fact that whether it is possible that this single bite caused the death of the individual, or there are some other suspicious causes that basically led to the death of the individual. In cases of foul play, for instance, sometimes when we as forensic toxicologists are dealing with a lot of cases, we are doing a post-mortem and we are conducting it, we go through the fact that it is appearing to be an accidental case of death by a scorpion bite. And when you send the samples, for instance, the stomach washing is sent for the lab investigations, and all that is going to highlight the fact that it is a case of an entirely different poisoning that took place, which may be an ideal homicidal poison. So it's very important that you look for the medico-legal aspects whenever you're dealing with the cases of poisonings. A lot of deaths may look accidental on their appearance, but when you investigate these cases, you would find out that there is some sort of a foul play that you're dealing with, and that would suggest or that would make it suspicious that this is a case of a homicide, or it can be even a case of a suicide. So investigating in a proper direction is very important. And even though if it is apparently, the death is apparently due to a scorpion bite, you would still be sending the samples for the laboratory investigations in these patients. So this is how you carry out the postmortem examinations and write down or document the cause of death, and make sure that you're going in the right direction while you're carrying out these investigations in the patients. Even there are multiple factors that is going to enhance the outcome or that is going to enhance the results for these individuals. Now, whenever we are dealing with these scorpions and the venom is injected, coming back to the kind of venom neurotoxins or the toxalbumin that has been injected into the patient, what is going to manifest? It is going to release the alpha toxins, and these alpha toxins are basically going to act on the parasympathetic nervous system of the individual. The acetylcholine is going to be released. It is going to bind on the cholinergic receptors, and that is going to decrease the cardiac rhythm. That is why sometimes the patients have bradycardia that they are suffering from, and they need a ventilator that is to be present at the hospital setting for such patients. So this is the kind of mechanism sometimes that is going side by side the other mechanisms as well. On the other hand, there are a lot of situations that is going to enhance the outcome for these individuals. For a lot of individuals, there is a poor outcome even after the treatment. The reason behind is if you come across a patient who has an altered level of consciousness, he or she is suffering from tachycardia or tachypnea, pulmonary edema is developing, and there is malignant hypothermia. The temperature is rising and is not responding to any kind of treatment. That is known as a malignant hyperthermia, and that is going to highlight the fact that the patient is going into an anaphylactic shock. And we have to give the treatment accordingly for these patients. Now, after there is a decrease in the cardiac rhythm, there can be cardiovascular disorders that the patient is having. Now, what kind of cardiovascular disorders? There is going to be a hypertension, there is vasoconstriction in the peripheries, and that is going to result in the hypertension in the individuals. Tachycardia is going to be present in these individuals. Now, whenever there is a sympathetic nervous system that is activated, catecholamines are released and resulting in the binding on the adrenergic receptors subsequently. It is going to increase in the cardiac rhythm and resulting again in the cardiovascular disorders subsequently. So these are the two mechanisms, either the parasympathetic or we even have the sympathetic nervous system, which is activated after the toxalbumin is injected in the individuals. Regardless of the fact, whatever course of events takes place, the resulting clinical picture would be the cardiovascular disturbances in the individual, and that are basically encountered by whenever we give the treatment with the diuretics and coupled up with the prazosin, the fluid overload is also balanced out. So all of these are the symptomatic treatments that are going to encounter all of these cascade of events resulting in the cardiovascular abnormalities in the individual. All of these cardiovascular abnormalities is going to result into the pulmonary edema due to the backflow of the pressure in the lungs. There is going to be an overload of fluid in the lungs, resulting in the pulmonary edema, or basically indicating the cardiac failure, either systolic or diastolic. But whatever the case, it is basically indicating that the patient is going into a cardiac failure. So this is the sequence of events that is going to lead to the death of the individual. Now, regarding the signs and symptoms of the scorpion venom, having known that this is the cascade of events, there's going to be breathlessness, tachycardia, cerebrovascular accidents are going to take place. What are the main features of the sign and symptoms? Local irritation, of course, whatever is the site of bite, there's going to be a local irritation accompanied by swelling, accompanied by the local necrotizing fasciitis, and signs of inflammation are going to be present at the bite site. Then obviously burning pain is going to be present, and local irritation and burning pain. These are two signs that are accompanying any kind of sting bite that we're dealing with. Either it is the snake bite or the scorpion bite, bee wasps even. They are producing the local irritation and the burning pain in these individuals. Along with that, there are some systemic features that the patient is also facing. These are basically ranging from headache, and again, we have the giddiness, dizziness. Sometimes when the patient is going into complications, there can be altered level of consciousness along with these headache and giddiness and neurological signs and symptoms along with these phenomena. Then the patient may also experience nausea, profuse perspiration due to the sympathomimetic activity, muscular cramps, agonizing pains, and the patient can ultimately go into a comatose state. So these are the signs that are present. It's a variable picture when we see from patient to patient. You can not really generalize all of these signs and symptoms, and they're not sometimes present all in all in a single individual. It is again going to depend upon the type of the animal that bit the individual, the number of stings that were present, and the number of animals that were involved in this particular incident. So this is going to enhance the picture and is going to change from situation to situation, from case to case. It is going to be an individual scenario, and you have to deal accordingly, according to the signs and symptoms, according to the clinical presentations, whether the risk factors are present or not, whether they are the vulnerable individuals or not. That is going to basically make the picture more complicated as well. Then the patient can also have myocardial damage in the red scorpion bite. So this is one of the scenarios. Either it can be the neurological manifestations, or either it can be the cerebrovascular accidents that can take place. Now, the grades of the scorpion venom, how do you classify according to the grades or according to the complications that are occurring in the individual? In grade 1, there are only local effects seen in the individual. There would be local itchiness, burning sensations, pain, or swelling. So the inflammatory signs would be present, but there would be no systemic features that are associated at this level of grade 1. On the other hand, we have the autonomic excitation, then we have the agitation and anxiety. So again, it is going to accompany all of the other insect bites as well. The anxiety, the agitation, the nervousness, the sympathomimetic activity is going to increase along with this patient that is going into grade 2. After realizing that he or she has been bitten by a poisonous animal or a venomous animal. Now, while dealing with a patient who is in grade 3, he or she may be suffering from pulmonary edema. So there is already a situation of cardiac failure. The patient is going into cardiac failure. There is a fluid overload that is accompanied by the development of pulmonary edema. Then hypotension and cardiogenic shock would also be seen in these patients. Severe neuromuscular excitations are present when you examine these individuals, because there is an uninhibited sympathomimetic activity. So that is basically going to result in the neuromuscular excitation. Now, patients in grade 4 would be having the multi-organ failure, seizures, and as well as the cardiac situation is deteriorating, and there is cardiac failure. So there is a clinical picture of cardiac failure, and along with that we have pulmonary edema. So basically, the patient is going into a multi-organ failure. This is the kind of situation with a patient who is in grade 4. So these are the normal classifications depending upon the set of sign and symptoms that we're dealing with accordingly in the patient of the scorpion venoms. Now, the scorpion sting wound, how do you identify this wound? Sometimes it's basically a single wound that is present. How do you differentiate it from a snake bite is very important. That would involve two distinct fang bites that are present at the site. Over here, in a scorpion sting bite, there would be signs of inflammation, there would be signs of infection. And along with that, there would be an area of sting that is present. Agonizing pain is usually accompanying this situation of scorpion sting bite. There would be, as you can even appreciate over here, there are signs of redness and swelling. But there is a single bite that you can even observe, or there can be even two individual distinct bites over here. So this is a situation whenever we are dealing with a scorpion sting bite, and how do you identify even these cases on a post-mortem table, and you want to just certify that this death has been caused by a scorpion bite. You have to basically make sure that a scorpion was present and that really caused the death of the individual after the administration of venom. Now, considering the medico-legal aspects in these cases of scorpion bites, again, we must be knowing this fact that this is usually an accidental case. But even whenever you are keeping this in mind that this was an accidental phenomena that took place, you have to make sure the other means as well. You have to carry out the post-mortem examination in a normal manner, sending out the specimens from the stomach, the kidney, liver, heart, brain, lungs. All of these have to be sent to the laboratory as a part of the specimen analysis that is conducted as a normal routine in the other postmortems that we conduct. Because there is always a suspicion of foul play whenever we are investigating any kind of death, even if it is accidental, we have to look for the other features as well. If we can look for them, and if we can find any positive finding, is very significant over here. So we have to look for all of the aspects. Usually, if it is basically thought to be a death that was caused due to the scorpion bite, it is usually an accidental case that we are dealing with. Now, having known the different types of the animal bites that we can work on with, we know that the most venomous and the most of the fatalities are basically caused by the snake bites. Then we just studied another case, which is the scorpion bites that may usually even cause fatalities whenever the patient goes into an anaphylactic reaction. Out of these, we have a range of other animals: bees, wasps, fire ants. Again, we have a very important variety which is known as the brown recluse. It's one of the spiders that can even result initially, it is just causing a normal phenomena, and it is not causing even any local sign and symptoms in the individual, but eventually it causes a lot of inflammation and a lot of pain for that particular individual. So sometimes a lot of spiders, specifically black widow is one of the species that can cause fatalities in the individuals. So a lot of these animals even can result in the fatalities of the individuals. And again, like any other venom, these spiders can even inject the venom, and that individual is sometimes they show the anaphylactic reaction towards that venom. So this anaphylactic shock sometimes results in the fatalities of the individuals, and we must know how to deal with these cases of spider bites, and how to differentiate again between a poisonous and a non-poisonous condition. Washing and rinsing off the bite site is very important over here. This is the usual varieties of spiders that we usually come across, and we must know that these kind of spiders, how do you basically go through the different characteristics? You cannot really depend upon the physical characteristics of the spider and classify them until and unless you know the exact species of the spider. So you treat the patient in a general way and again in a symptomatic manner whenever you're having these patients. Now, usually the patients of the spider bites, they come up to you and they have a history that they have been stung at a single site or at multiple sites by a spider. So knowing that history, getting into the details of the history, the past history, and even the past history of any stings is very important. Noting down any anaphylactic clinical sign and symptoms is very important over here, because that would basically make you towards the fact that how can you treat these patients, how can you manage these patients accordingly, whether this patient has some sort of anaphylaxis towards any sort of venomous activity or not. The kind of venom that we usually encounter in spider bites is the venom gland is present over there, and that is resulting in the polyamine neurotoxins. So they're usually affecting the neurological activity. The nervous system is usually affected. Free amino acids are found in their venom. Then we have monoamines and inorganic salts. So these are the secretions of the venom gland that is present in these spiders. On the other hand, we have the enzymatic toxins, and these are going to have the significant activity upon the different systems that they're going to affect. We have these sphingomyelinases, and then we have the hyaluronidases that are basically going to act upon the hyaluronic acid. Basically, the circulatory system is going to be attacked by these kind of enzymatic toxins out there. Specifically, we have the phospholipases even present over here. These enzymatic toxins are going to give out the clinical sign and symptoms in these individuals. They can be even the hemorrhages if they cause them locally or even internally or externally, depending upon the situation in the patient. Then we have the proteases. These are again one of the list of enzymatic toxins that are present. We have the collagenases that are causing the disintegration of the collagen or the fibrin activity. Then we have the phosphodiesterases over here. Then moving on, we have the alkaline phosphatase over here, and then finally we have the ATPases. Then we have the peptideisoberases. These are the list of enzymatic toxins out here in the spider venom. Ultimately, it is going to affect the neuromuscular junctions. Even the muscular activity can be affected by these enzymatic toxins when they're released into the circulation. The location of the sting is very important. If it is a central location, for instance, the neck of the individual, it is going to enter the circulatory system quite quickly. So immobilizing the site of the sting, if it is a limb, you have to completely immobilize it. And the application of the tourniquets is basically obsolete these days. You just keep the limb lower than the level of the heart. So this is the general measures that you even take in cases of the spider stings that take place. Then we have the non-enzymatic toxins ranging from peptides. We have the translationally controlled tumor proteins. These are some of the non-enzymatic toxins that are released. We have serine protease inhibitors over here. Moving on to the mechanism of action that is going on with the spider venom, we have the widow spider venom that causes the massive release of the neurotransmitters at the neuromuscular junctions, of course, and causing the stimulations of all the nerve endings. So this is the kind of mechanism of action that we observe in cases of the widow spider, or which is also known as the black widow, which is causing the fatalities in the individuals. It is going to result in rigid paralysis in the individuals. The muscle rigidity is very common with these kind of spiders that we're dealing with. Then we have the Latrodectus, which is present in the black widow. This is the spider venom, and it is basically the alpha latrotoxin. It is also known as the alpha latrotoxin. The opening of the non-specific cation channels, it basically increases the influx of the calcium ions, and it is going to result in the indiscriminate release of the acetylcholine. And that is going to finally result in the excessive stimulation at the neuromuscular junction. So the site at which this black widow or this spider venom is going to act is the neuromuscular junction. The acetylcholine activity is going to be increased at the neuromuscular junction. It is going to be not to be the cholinesterase that are usually present. The mechanism of action that is underlying this activity is the increased influx of calcium that is taking place at this neuromuscular junction. Now, the type of paralysis that is going to be accompanied by the sting after this black widow spider is going to be a rigid paralysis rather than a flaccid paralysis. So this is how you're going to basically differentiate that it is a species which is basically acting on the neuromuscular junction, and it is causing the excessive stimulation at the neuromuscular junction. Now, this is going to lay the foundation towards the respiratory distress in the individual, because the paralysis, the rigidity of the muscles is going to even affect the muscles of the respiratory system, and even the patient is going to need the ventilator in specific instances or in complicated instances as well over here. Now, regarding the clinical manifestations of Latrodectism, when we're dealing with that, Latrodectism is obviously a syndrome that is produced by the, whenever there is a sting, and that is produced by the black widow spider. We're going to term it as a syndromic condition which is known as Latrodectism. So this is due to the enzyme that was produced. It is going to cause a severe pain in the individual, an agonizing pain in the individual. Symptomatic treatment, again, I would like to basically lay focus on the fact that we even have to symptomatically treat the patients as well. The risk factors are going to be same for any animal bite or for any insect bite over here. For instance, it can be the extremities of the age, the debilitating conditions. Even you have to focus on the history, whether the patient is suffering from any long-standing debilitating conditions such as hypertension, diabetes mellitus, because that is going to aggravate the complications that are produced due to this fact. Severe pain is one of the major clinical feature over here. Then moving on, we have severe cramping phenomena in the abdomen. Abdominal muscles may be involved in it. Headache is one of the very important feature over here. Moving on, the patient is going to complain of restlessness as well. Anxiety and fatigue are two very important features over here. Even the patient can have the altered levels of consciousness being observed over here. So it is depending upon the complications of the situations that we're dealing with. And insomnia can be one of the feature, and that may be accompanying all of the pain and the agonizing cramps and the headaches that the patient is having. So you usually basically give painkillers, anti-inflammatory drugs, and barbiturates are even coupled up along with this symptomatic treatment for every patient who is suffering from this kind of Latrodectism phenomena. Then there can be an increased salivation phenomena as well. The patient may be also suffering from increased lacrimation. Diaphoresis, that is basically an increased sweating, is one of the phenomena as you would be seeing or as you would be observing for these patients. Then the patient may have slight tremors because the neuromuscular junctions are being affected. So that is going to manifest itself as slight tremor condition, tachycardia, increasing the heart rate, bradycardia, lowering of the heart rate. Hypertension is one of the phenomena over here. Shock, it can be even a circulatory shock, or it can be an anaphylactic shock that is observed over here. The patient, if it is a complicated case, the patient can even go into a comatose condition. So you must be knowing how to deal with these complicated conditions. You have to examine the patient quite deeply, and you must be well versed with this condition, that either this particular individual case is being complicated or is subject to any complications or not. And depending upon that fact, you should be knowing what are the emergency treatments out there to manifest or to control the situation whenever it's a complicated case. The spider bite wound would appear like this. It is basically again going to be very small. Even if it is a late stage or the patient presented to you after some time, it can have an abscess out there, and it can have the signs of infiltration or signs of inflammation that are accompanying at the bite site. So the history is very important. Examination locally as well as systemic examination is the mainstay over here whenever you are treating these patients of spider bite wound, and you must be knowing about the complications regarding this kind of situation. So over here in this lecture, we briefly summarized the different animal bites that we can encounter as a medical officer, and you should know how to investigate these cases as a forensic toxicologist as well. What are the fatal doses? How do these venoms act on the body? And what can be the clinical sign and symptoms or the postmortem appearances out there. So that is the end of this lecture. Thank you for watching sqadia.com.